Delighted to have with us here at ASCO 2014 is Dr. David McDermott from Dana-Farber Harvard Cancer Center in Boston. Thanks for being with us, sir.
Glad to be with you.
Let's talk about the PROCLAIM registry data that you presented just here at this conference.
So the PROCLAIM registry is an attempt to get a modern look at interleukin-2 across a wide variety of sites, trying to get a sense of how the drug is working both from an effectiveness point of view and from a side effect point of view in a more modern era where we have many more therapeutic options for patients with kidney cancer.
What does the data suggest for combination immunotherapy and drug sequencing?
Well, it's very interesting results, and there are going to be more results to come. The first results presented today were a look back over the last couple of years at about 100 patients who had received interleukin-2 and then gone on to receive other treatments. And it showed very good tolerability and very encouraging effectiveness with impressive median overall survival of over 50 months in the group of patients who started on interleukin-2 and then subsequently went on to the more commonly applied VEGF TKI group of drugs.
So what implications do you think this data shows for better patient outcomes in the future, and what will you do next with it?
Well, I think at the moment it's useful, and when we just try to decide what to do first, it suggests that immunotherapy first is important, and it doesn't decrease patients' chances of having a good outcome if you try something like interleukin-2 first. It often doesn't work, but when it doesn't, patients can be well salvaged by these other treatments and lead to an impressive overall survival. But ultimately, with new agents coming into the clinic, we hope, it also implies that we may be able to use them earlier in the patient's condition and save these other treatments for when immunotherapy fails. Now, obviously, we need to do that in the appropriate patient, not in every patient. We need to do better at selecting patients who are likely going to benefit from immune therapy. But in those patients, their overall survival outcomes are encouraging.
Very good. Dr. McDermott, thanks for stopping by and
Sure.
sharing your information with us, and best of luck to you.
Great. Good to be with you.